Next one we talking about edema. Infantile edema. 小儿 is children, 小 is small, 水 is water, 肿 is swollen. So that's TCM name, 小儿水肿. So infantile edema or pediatric edema, so that's basically actual fluid like go to the body tissue and landing locally swollen in there. So that's basically we talking about edema. It can affect any part of the body, but mostly happens on the terminal area, like the hand, or arms, or feet, or legs. So in Western medicine or modern medicine, for children's edema, I like to use the pediatric edema. If we use infants, look like so small children, but mainly all the children, any age, they possible have it. So I like to use the pediatric edema, but CTCMA translator, they use the infants. So for modern medicine, usually belong to kidney disorder. Nephritic syndromes. Nephritic, that's the medical word, kidney, and syndromes. So basically, kidney have disorder happens like in the nephral area, that's the basic small unit of the kidney. The filter function have some disorder. Then lot of blood protein leaking out, urine in the protein, and circulation blood plasma protein is decreased. Then cause the water retention, then cause the edema. So that's generally happens. So that's basically what happens in there and what's the edema in there. So we say nephritic syndromes is the condition or problems. So basically, big amount of protein losing in the urine, and then landing the protein level in the blood circulation is decreased. So hyperproteinemia, that means blood protein is decreased. And sometimes with hyperlipidemia, yeah, fat level in the blood circulation is increased. So that's these situations. And then cause the edema. So mainly problem for this one is the edema. That kind of edema relationship with kidney, glomerulus. So linking too much like a protein. So that's basically happens in the basement memory part. Lot of protein, especially albumin. That's the protein produced in the liver. And the most big amount in the blood circulation. But they are small size compared with other proteins. So that's why it leaks out from the urine. like a big amount of protein relieved from the urine. So that's mainly problems in there. Mainly problems. So what's caused? What's caused? For modern medicine, mainly thinking about relationship with autoimmunity disorder. For TCM, some genetic differences, like a kidney deficiency. We also talking about lung deficiency and spleen deficiency. That we talking about for children, organ not totally developed yet. So that's the difference in there. And or maybe people have other illness, long-term illness, damage body junction, and then the passenger easily evading to the internal, then cause the edema situation. So sometimes people call the common cold, and then later on the finding for edema. So that's basically for this situation. So when we're talking about edema, for TCM and modern medicine, little bit different relationship with the organs. For TCM some organs, we're talking about three organs directly relationship with edema. Lung, regular water passenger, like with dispersing function, and spleen TNT function, sending the water all over the body, and kidney relationship with relieve extra water from the urine. So for infantile edema, mostly is kidney function, losing function. But truly we have some other patterns, relationship with other organs. For modern medicine, that be different. Still three organ relationship with edema. One is heart. Heart circulation, blood all over the body. So if heart have issue, like a heart failure, so that means heart couldn't pump out blood to the body. Inside heart, pressure will be increased. That pressure increase affected the veins, especially lower part of the body, the veins. Couldn't return back, the blood go back to the heart. So that's the heart can cause the edema. And another organ we're talking about for modern medicine is the liver. Liver can cause edema, basically, just like we talked about. Liver producing the protein. Liver have disorder. It is not able to produce enough protein. So in the blood circulation, plasma protein decrease. Protein generally they can hold in the water in the circulation. If they don't have enough protein to hold in the water will be linking to the tissues. So that's the liver. Another organ, the same with TCM, kidney. Kidney couldn't relieve extra water, so that's still the liquid go to the tissue. So that's the general idea we're talking about edema here. So TCM patterns for the edema, the root mainly caused by deficiency disorder. So we say in TCM, we have three organs relationship with water regulating. One is the lung, one is the spleen, another one is the kidney. So for the children we talking about before, their organ always different, especially for the lung and the spleen. So basically the pattern, they will have qi deficiency symptoms. So edema, we're talking about lung edema, mainly go to upper part of the body, face part, arm part, and the spleen edema may in the middle part of the body, middle jaw. So that's general edema, especially on the face, we can see. Patient edema, water retention, causes scanty kind of urine. Water couldn't relieve by the urine. And the face, pale face, and the qi deficiency, short breath, and fatigue, and poor appetite, losing stool. And also can have spontaneous sweating. And pretty easily getting cold because qi deficiency, including wei qi deficiency. When children got wei qi deficiency, they will easily catching cold and maybe short breath, withdrawal, cough. So that's the lung symptoms there. Tongue still pale and enlarged because water retention caused the swollen tongue in there. And the pulse is a weaker pulse. Deficiency kind of weaker pulse. The treatment principle, 25 qi, 25 spleen qi, 25 lung qi, and promote urination, reducing edema or relieving edema. So the points we use mainly 25 lung qi and spleen qi. So we can go to back through of the lung, back through of the spleen. We also can go to yuan south points of the spleen, and also yuan south points of the lung. And the spleen 9 relieve water, actual water. So that's basically we use. Certainly we can use moxibustion. Moxa. We can moxa for background points. We also can moxa for generally qi 25 points, like ren 4, even ren 6, ren 8. And ren 9 still good points for regular water. Yeah, that's the water poise. 忍耐。Then we're talking about the pattern spleen deficiency with dampness. We say we have 3 organs, regular water, lung, spleen, and kidney. So this pattern mainly spleen disorder, spleen qi deficiency. So that's edema, mainly on the body part. Also can go to the limbs. The face is dull, yeah, shallow, that be yellow, that's spleen color there. And generally fatigue, people tired, spleen qi deficiency, generally weaker, and also poor appetite, losing stool, that's spleen qi deficiency, and still scanty urination because actual water couldn't release. So that's basically for these patients. Abdominal distension and still spleen stomach disorder. And also can cause some chest stiffness because some dampness blocking inside. Severe kind of case, qi deficiency lending yang deficiency can cause the cold limbs. The tongue pale color still and swollen there. The pulse basically is deeper pulse. It means internal disorder. And the viral pulse can coming from water retention. Yeah, viral pulse coming from 3 situations. Certainly, most case we talking about liver issue. But the painful situation, like a water retention kind of situation, dampness of lung, still can cause. Treatment principle, tonified spleen and drain dampness, reducing the edema. Yeah, that means some dampness blocking. Yes. So treatment, yeah, treatment. The points, yeah, points pretty similar like last one, but we're adding more points to reducing some dampness. Yeah, regular water reducing dampness. So marks are still working for this way. Yeah, for this pattern, marks are still good. Yeah, marks are still good. So we can use pretty similar points we use for marks are. So basically, still spleen tonify points there. Yeah, spleen 3, spleen 6, and even Ren points, Ren 6, Ren 4, and the back through of the spleen, the bladder 20. So that's still can use for this case. Then we go to kidney yang deficiency pattern. Kidney yang deficiency. So we're talking about edema caused by yang deficiency. Usually it's PT edema in there. Put your finger there. And then after you remove your finger, you still can find the PT in there. Yeah, divided in there. So especially in lower part of the body, mainly lower limbs, and also can form the west area, abdominal area, and then go down. So that's basic kidney edema caused in lower part of the body. And the pale face, and the patient have cold symptoms, aversion to cold, and cold limbs, and generally qi deficiency. Yeah, qi belong to yang. So yang deficiency is qi deficiency plus cold size. So fatigue, yeah, fatigue. And tired, yeah. Prefer to lay down means tired. So we know the case. The case always try to like running outside, play. They never stop. Yeah, they never stop. When you find a case, especially don't like play outside, they try to lay down. Truly, the case is sick. So that's basically, and still less urination. Yeah, less urination because more water retention inside. This kind of water, we say mainly go to lower part of body and maybe like middle part of body, but still possible go to cavity of the body. They possible go to pleural cavity. They possible go to abdominal cavity. So that's water retention in there. So yang deficiency type of the edema, even more severe. So that's also patient generally weaker, don't want to eat, and losing stool. Some middle jaw problems in there possible for children, and nausea, vomiting. Tongue is still tongue and swollen, and the teeth mark on the side. So that's truly the symptoms of the like water retention. Tongue coating slippery, yeah, slippery tongue coating, pulse deeper, and the deficiency kind of pulse. So that's generally for spleen yang and kidney yang deficiency type. So we still put spleen and kidney together. So children's problems mostly is not only one organ, because when we talking about physiology kind of children's bodies, generally say that all the organ is weaker, yeah, is weaker. Then treatment principle. We need a warm, yeah. Yang deficiency, we need a warming kidney yang and tonify spleen qi and drain the water, reducing the edema. So still, we still need, especially need maxa for this one. Yes, especially we need maxa for this one. And certainly, yes, certainly, the points we specially tonify the spleen and the kidney. And the do four is pretty good points, kidney yang tonified. We also can maxa there. Yeah, we also can maxa there. And we can adding more points for maxa. Then we're talking about another pattern, kidney yin deficiency. So kidney pretty commonly with liver yin deficiency together. We're talking about yang deficiency. Usually they will come in with spleen yang and kidney yang together. When we talking about yin deficiency, pretty commonly liver yin with kidney yin together. When we talking about the qi deficiency, pretty commonly spleen and lung together. So that's the functional relationship. So liver and kidney yin deficiency, so they still have edema. And then other symptoms is yin deficiency symptoms, like a dry mouth, dry throat, and 5-center heat, sometimes night sweating. Liver yin deficiency, like a heat will be rushing up, thus will cause like some symptoms in the head, like a headache, dizziness, and also cause the red face and dry in the eyes or maybe poor vision. So that's generally liver yin deficiency. So they put generally liver yin deficiency symptoms there. Acne is not that common for the children. So we can remove that part. So that's generally kidney yin deficiency causes edema. Tongue will be red tongue. And the pulse is rapid pulse. Could be thin pulse or serrated pulse. So treatment principle for this one, we need nursing. So it's nursing in and tonify kidney and soothing the liver, subduing yang, and drain the water. Mainly we still try to reducing actual water and try to relieve edema situation. So points, we go to kidney points, kidney yin nursing, and the liver points, yuan south points of the liver. If too much heat goes upward, we can go to liver 2. And we can go to some gallbladder points, clear some heat in the liver gallbladder, like gallbladder 34 or maybe gallbladder 43. And the spleen 6, generally in nursing, and the bladder 60, relieve extra water. So that's for this pattern. Sometimes patient may have qi and yin deficiency same time. So generally say the symptoms. Qi deficiency symptoms with yin deficiency symptoms. So that's generally say we put different symptoms together. That's pattern. Qi and yin deficiency symptoms. The tongue It's pretty different. Yeah, pretty different. So we know qi deficiency tongue will be 飘tongue. In deficiency tongue will be right tongue. So it's depending, it's more severe qi deficiency or maybe more severe yin deficiency. Severe kind of qi deficiency, tongue maybe go to 跳 side. Severe kind of yin deficiency, tongue maybe more go to right side. But generally say slightly right tongue here, you can think about the pink kind of tongue here. Just like our nose, just like our nose here. Yeah. Still kind of red color, but not too red. Yeah, not too red. And not totally pale. Yeah, not totally. Pulse, still weaker pulse. And the treatment principle, we need 25 qi and nursing in and relieve some dampness. And yin deficiency will generate some heat. We need clear heat. So acupoints, we have qi 25 points here. And we have yin nursing points here. Certainly you still can add in like a kidney 6 there. In mostly relationship with the kidney. And we have regular water points here. You still can add in like stomach 14 there. But like we say, for children's problems, we try not to use too many needles. And we try not to use too many points. But truly, you can use acupuncture instead of needles. And these conditions, sorry, I try to put the stomach 36. That's wrong number there. Yeah, that's let me know. Yeah. So for this kind of condition, we always discuss if we use maxa or not maxa. So we say deficiency maxa is good, but heat maxa is not good. So qi and deficiency same time, we see patient's condition is more severe deficiency or more too severe heat in there. So if severe heat in there, maybe not maxa. But patient have some heat symptoms, but not that severe. We still can use maxa for tonify. I like for yin deficiency kind of problems. I like maxa for kidney one. We know heat always rushing up. Lower part of the body always cold, always cold. And the kidney one is the start point of the kidney. So like some generally kidney qi start from there. So that's usually, especially for deficiency kind of patient, I perform massage for kidney one. So that's we talking about the pattern. We say the root pattern. Root pattern for the children. That's generally internal organ, not maturity yet. So different kind of deficiency in there. Then we talking about bunch pattern. Bunch pattern generally say is some passenger coming in. That's caused the edema area. So the first pattern we're talking about wind pattern. Yeah, external wind caused. So that means EPI emitting. EPI, external passenger wind. We may have like wind cold condition or maybe wind heat condition. But generally it's wind cause problem. So that's fever, aversion to wind, same time. Usually no sweating. Yeah, usually no sweating. And body pain. Yeah, that's generally nose discharging. That's generally EPI emitting symptoms. Sometimes cough and with withdrawal. And maybe sore. So that's basically generally EPI emitting. Sometimes can cause swollen painful tonsil. So tongue is not changing too much, floating pulse. Treatment principle, yeah, with the EPI condition, relationship with the lung, lung losing functions. So that we need diffusing lung and dispersing wind, and the edema problems, we need drained water. So the points we use the similar like we talking about common cold EPI emitting, like I4, lung 7, and do 4 basically kind of warming internally and build up the children's bodies, and gallbladder 20 for wind. We can add in more for relief like extra water, like spring 9, and maybe ren 9 there for relief extra water. So that's for this one. External passenger evading. For myself, usually I will not use massage. Just this person wind. The passenger go away, the body will be recovered. But truly, in some case, their body originally have weakness. That kind of condition, you still can use massage, especially with cold evading. We still can use massage. Then another pattern we talking about water and dampness. That's internally kind of excessive kind of water disorder. So this pattern generally say is a little bit severe kind of pattern. So these patterns still can originally caused by like a spin deficiency, but it's most severe compared with the spin deficiency caused water. It's more water retention inside. So that's we're talking about edema all over the body. And the skin pretty tender. We can see pretty severe kind of swollen all over the body. And also patient may be caused water go to abdominal cavity. And also something go to intestine. We can hear the sounds. Yeah, we can hear the sounds. Gurgling kind of sounds coming from intestine, like always have water flowing inside. And chest stiff, make patient short breath. And the stomach fullness. So that's generally say this pattern is more severe. Yeah, it's more severe pattern. Pulse is deeper. If they caused by deficiency, maybe still deficiency kind of pulse there, or maybe very pulse in there. Tongue is more moisty. Yeah, tongue is more moisty. So that's for this pattern. So treatment principle for this pattern, we still need to tonify qi. We say originally kind of spleen qi deficiency, TNT not working, then cause more severe kind of water retention for this pattern. So we still need like draining the water and reduce swelling. So this pattern, the symptoms is more severe. So we mainly focus on the mainly symptoms and the signs, like after we relieve the water retention, then we find out which organ is weaker, then we more tonify it. So acupoints, we still mainly focus on the tonified spleen functions. And sometimes they may cause by external reasons. So we still go to LF4, lung 7, and the regular water, the 9. Certainly we still can add more. Yes, spleen 9. And this one, if no heat set there, marks are still working. Then we're talking about the damp heat pattern. Damp heat pattern is some dampness combination with heat. So basically, skin still swollen, and sometimes it's kind of bolus on the skin. And the patient can have bitter taste in the mouth. So that's basically some heat signs. Thirsty, coming from heat. Don't like to drink, is water retention inside. And still cause like a stomach fullness. And if people feel stomach fullness there, it's truly for appetite, don't want to eat. So scanty urination. I think they just try to say frequently scanty urinally. They're changing this word for urinally scanty urination. It's not frequently. And feel some like a burning sensation sometimes during their urine because damp heat. And some like dripping down sensations in the abdominal area. That's still caused by damp heat. The tongue is red and the yellow coating, that's heat. Greasy coating coming from dampness. Rapid pulse coming from heat. Sleepy pulse coming from dampness. So all treatment principle need clear heat drain the dampness. So the points, we need some points clear heat. That's generally clear internal heat points, and we also some points drain dampness. And generally say, Ren 3 is pretty good for promote urination. It's close to lower GI. So that's basically the mainly pattern for this illness. Then we're talking about some prevention. Prevention. How to prevention the problems. So basically, we try to find the case if their skin has some damage there. So that kind of situation, or maybe sometimes people got EPI emitting, like cause tonsillitis, or maybe they have some teeth problems. So that kind of situation got treatment immediately. So otherwise, maybe development to other illness. And the same reason, people have like EPI infections, respiratory tract infections, pretty easily cause the problems. So preventing any kind of like a common cold or EPI infections and keep the skin clear, and generally say that's the kind of preventing way, keep a healthy lifestyle. And nursing care. So nursing care means patient truly have edema already, truly get sick already. So if they have like a severe kind of edema, let's take a solidium. So solidium truly holding water inside, and sometimes even cause high blood pressure. And also maybe drink a little bit less water. So they have water retention already, but truly we still need to drink water. Not totally not drinking, but just get some like less drinking there. And certainly give nutrition, help patients easily recover. And also for the protein. So these kind of patients truly need protein because mainly they will losing lot of protein from the urination. So that's protein couldn't hold in the water inside and cause edema. But truly, you give more, they losing more. So that's basically we keep some amount, we calculate by the children's the body weight, and for a day, keep that range of amount there, not too high, not too low, and still keep the skin hydrogen. So that's the mainly ruler we're talking about the nursing care.